Well, good evening, and thank you all for being here today. I'm joined by our PC health critic, Jeff Urich, and I know Jeff was acknowledged earlier, but he is doing a great job at talking about healthcare in the legislature and constantly raising issues on behalf of physicians and nurses and healthcare practitioners, and we're very lucky to have Jeff in our caucus. And to RNAO, I wanted to say very grateful for the input we get from you. I've recently, just in the last few weeks, had the chance to meet with chapters in Windsor and Halton and met some talented nurses with great ideas for our health system, and very excited to be here today at your annual general meeting. Ontario's registered nurses, nurse practitioners, and nursing students are some of the hardest working people I know. You are always looking out for what's in the best interest of your patients. You live the healthcare system on the front lines. And I can tell you, if Doris has been in this role for 20 years, I may not be your traditional progressive conservative. If you'll notice, the issue that I've asked the most questions about in the legislature, unfortunately for Eric Hoskins, is healthcare. I talk a lot about healthcare because I'm passionate about it. And I can tell you the first place I volunteered was RVH in Barrie. And I think healthcare is the backbone of any community. And in my own office, as a reminder of the importance of healthcare, I think of my grandmother. My grandmother, when she passed away, she had a certificate on her wall, which was her volunteer certificate for being a blue coat, which is what they call the volunteers at RVH, for 45 years. And so I took her certificate and I put it behind my desk at Queen's Park as a reminder that her passion is the passion that we have in every community, that we, you can have everything else in life, but if you don't have your health, it doesn't mean much, and it's a priority for Ontarians. And I worry that for far too long we've been hearing the same things. We've been hearing the population is aging and has increasingly complex health conditions. We have to better use our healthcare resources. The dismal state of Ontario's home care system must be addressed, but I'm not seeing action or solutions. We don't see the long-term planning necessary, and it's causing weaknesses in the system that have to be addressed. I worry that the LHINs continue to fail to meet their performance targets and have allowed wait times to increase. The standard of care can be better. The inequities in access to healthcare throughout the province are quite significant in different parts of our province. The fact that 39% of healthcare dollars in home care don't go towards patients is a huge problem. And we're seeing it. We're seeing it across the province. We're seeing the effect of these transformations or shifts. Governments never like to use the word cut. It's always better to say transformation. But as I travel the province, I hear it. I see it. When I meet with nurses, I hear about it constantly. We've seen 9 consecutive years of hospital funding cuts, including 4 years of frozen hospital budgets. The reality is collective agreements are well beyond 0%. And so when you have a 0% with inflationary aspect in healthcare, you see a cut. And I think in the first few years, you saw short-term solutions. You saw Band-Aid solutions, whether it's not using an OR, not using an MRI machine, switching nurses from full-time to part-time, but they were Band-Aid solutions. And the result is we're at a point now where we're seeing real significant cuts that are hurting access to healthcare. Since we have Windsor here, the Windsor Regional Hospital announced they're eliminating 120 nursing positions that we can't afford to eliminate. 61 registered nursing positions were lost at St. Joe's Healthcare Centre in Hamilton. At London Health Sciences Centre, they had to eliminate 97 full-time positions, 350 frontline jobs in North Bay. We can't sustain those type of cuts. And a worrying trend is previously when they used techniques of operating room time and MRI machines and full-time to part-time, what I am particularly alarmed about today is the fact that we're seeing registered nurses being replaced by registered practical nurses at the expense of patient safety. And I'm calling a red flag on that. And let me be very clear. There is a place for registered nurses, registered practical nurses, nurse practitioners, and personal support workers in Ontario's healthcare system. All have valuable skill sets, and our healthcare system benefits from the mix of healthcare providers. However, these replacements are sometimes occurring out of desperation to meet hospital budgets, as a short-sighted way to balance budgets after years of government freezing. An example of this is the neonatal intensive care unit at St. Joe's Healthcare, who was faced with a $26 million budget shortfall. St. Joe's considered replacing RNs caring for sick and premature babies with RPNs, whose scope is traditionally focused on a lower level of acuity with more predictable outcomes. Thankfully, the hospital reassessed this plan following huge pressure and public concern on that change. But that's an example of how it can be very short-sighted. I'm pleased that Eric Hoskins today mentioned his support for having PTSD services available, access to treatment for PTSD for nurses. You have to see things that we never want to see. Minister Hoskins has members of his family who are nurses. I have members of my family who are nurses. And we have a huge debt to you for the sacrifice you make, the things that you have to see that would shock and affect anyone else. And that's why, along with the leader of the NDP, we pushed. We were concerned that nurses weren't included in the recent bill addressing the need for PTSD. This was a unique opportunity, given the fact that the public conversation and the conversation at Queen's Park was around better treatment for PTSD, and the fact that nurses were left out of that conversation, left out of that legislation, was disappointing, and there's no other way to put it. But I also wanted to say here today that there is no monopoly on a good idea, and I've probably said that about 1,000 times around the province. And when the government acts in the best interest of healthcare, I will praise them. When the government doesn't act in the best interest of health access, I will enthusiastically criticize them in the legislature. But I'm very, very pleased that Minister Hoskins has expressed his support on the PTSD issue, on the National Pharmacare issue, and also on the enhancement. And certainly we would be eager to work with you on expediting that in the legislature. I know the RNL holds a wealth of knowledge, and you are well positioned to gain from that knowledge, and I know we certainly will in our job as the official opposition. We will listen relentlessly over the next few months and next few years as we build a platform for the province and the policies that we believe could help enhance healthcare in the province of Ontario. So in closing, thank you for having me here tonight. Thank you for this opportunity. I'm actually racing to Ottawa now for events all day tomorrow, so I won't be able to join you for the rest of the evening, but have a wonderful AGM. Thank you.